My name is Cindy Anabel Garzón Lavalle, and I'm going to talking about invasive candidiasis. Definition: invasive candidiasis is an infection caused by this type of fungus called Candida. Unlike Candida infections, is in the mouth, on throat, oral thrush, or vaginal just infections. Invasive candidiasis is a serious infection that can affect the blood, heart, brain, eyes, bones, and other parts of the body. Candida, a bloodstream infection with Candida, is a common infection in hospitalized patients.
Hi, how are you everyone? Welcome back to my lovely channel. For your information, this video was created on 24 June 2018, 17 of hour, 46 of minute and 15 of second. In this lovely day, we are going to explain something. The thing is, what is invasive candidiasis? In the next few seconds you will get a short information about what is invasive candidiasis is. Hopefully it will help you. Enjoy the video. Here is the explanation about what is invasive candidiasis. Invasive candidiasis is an infection caused by a yeast, a type of fungus, called Candida. Unlike Candida infections in the mouth and throat, also called thrush or vaginal yeast infections, invasive candidiasis is a serious infection that can affect the blood, heart, brain, eyes, bones, and other parts of the body. Last update June 12, 2015. Now, we will give you 20 seconds to read again the explanation by yourself, so you can absorb this information. Please take your time. Hi, that's all of the explanation. If you find this video helpful, please like and comment on this video and subscribe this channel. Thank you, and see you again in another video. Goodbye.
Applications in medicine. Symptoms of invasive candidiasis can be confused with other medical conditions. However, the most common symptoms are fever and chills that do not improve with antibiotic treatment. Other symptoms develop as the infection spread depending on which part of the body are involved. Antifungals are used for treatment with the specific type of dose depending on the patient's age, immune status, and specific of the infection. For most adults, the initial treatment is an echinocandid class antifungal, caspofungin, micafungin, or any dulafungin, given intravenously. Fluconazole, amphotericin B, and other antifungals may also be used. Treatment normally continues for 2 weeks. After resolution of signs and symptoms, and candidates can no longer can be cultured from blood samples. Some forms of invasive candidiasis, such as infections in the body, in bones, joints, heart, or central nervous system, usually need to be treated for a long period. Retrospective and observational studies suggest that presumably antifungal therapy based on symptoms or biomarkers is effective and can reduce mortality. Preventative antifungal treatment is supported by studies but only for specific high-risk groups in intensive care units with conditions that put them at high risk for disease. For example, one group would be patients recovering from abdominal surgery that may have gastrointestinal perforations or anastomotic leukemia. Antifungal prophylaxis can reduce the incidence of fungemia by approximately 50%, but has not been shown to improve survival. A major change limiting the number of patients receiving prophylaxis to only those that can potentially benefit, thereby avoiding the creation of selective pressure that can lead to the emergence of resistance.
FlashMed. What specific species of Candida is most likely to involve the bloodstream? Candida albicans is the most common species of Candida to involve the bloodstream, causing candidemia. FlashMed has thousands of video flashcards on YouTube. Select one of our channels to view hundreds of questions and answers in sequence, learning one question at a time. Try it now.
Pros. The pros and cons of commonly suggested and prescribed medications for Candida problems. These medications include diflucan, nistapim, sporanus, and nisvaral. Both of the medications are intended to either kill the Candida microorganism or stop them from further propagating and causing more health problems. Diflucan is typically considered to be more of a killing or fungicidal agent. Nistapim, on the other hand, is more focused on stopping the growth and is therefore known as a fungicide medication. Like all medications, both come with pros and cons in their use. Both of the medications can be very useful in helping individuals get a quicker head on this overgrowth than may be the case with lifestyles and supplemental interventions. This can be particularly helpful when symptoms are more severe and the overgrowth has been established for longer periods.
Candidemia, invasive candidiasis treatment algorithm. The Infectious Diseases Society of America has developed guidelines for the initial treatment of candidemia and invasive candidiasis. Simple steps for treatment are outlined in this clinical practice algorithm. Successful treatment of candidemia and invasive candidiasis requires the recognition that treatment options differ between clinically stable patients with mild to moderate disease and clinically unstable ones with severe disease. If the patient is in a stable condition, plus the Candida species is known and there has been no recent azole exposure, the preceding therapeutic considerations are preferred. Treatment with daily fluconazole IV with subsequent step-down therapy to oral fluconazole is preferred. An echinocandin, such as anadulafungin, caspofungin, or micafungin, may also be used, but the patient may be transitioned to oral fluconazole when stable. Amphotericin B, or a lipid formulation of amphotericin B, should only be used if the patient is intolerant to other medications or other antifungals are not available. If the patient has severe disease and is in an unstable condition or has an infection due to Candida glabrata, Candida krusei, or an unknown Candida species, the following therapeutic considerations are preferred. It is preferred that treatment is initiated with echinocandin. Subsequently, if the patient stabilizes and is afebrile and the Candida species proves to be susceptible to fluconazole, then fluconazole may be employed due to its lower cost and ease of administration. Amphotericin B, or a lipid formulation of amphotericin B, should only be used if the patient is intolerant to other medications or other antifungals are not available. In all cases, therapy should be continued for 2 weeks after the last positive blood culture with Candida species and until symptoms resolve. In addition, when deciding on the therapeutic agent for candidemia, consideration must be given to other comorbid issues, such as renal or hepatic dysfunction and potential drug interactions.
Cons. Diflu can cause high rates of side effects with nearly 1 in 7 reported reactions, such as severe rashes, eating, skin inflammations, nausea, and abdominal pain. Dizziness jaundice, and liver problems. In particular, diflucan is noted for elevated liver enzymes. In more severe and rare cases, it can mistake cholestasis, hepatitis, and even hepatitis fairly in already weakened patients. Nistabine typically does not credit so many side effects as diflucan, but the list is still fairly lengthy. They can include diarrhea, nausea, vomiting, stomach upset, allergy, rash, eating, and splitting, and complications for those already dealing with AIDS, HIV, kidney disease, or diabetes. Both diflucan and nistabine interacting with a fair number of medications, including HIV medications in particular. For both of these medications, the longer and higher the dose you are not on, the greater the chance is of leading adverse reactions. Some reactions can also be accumulated over time.
Diflucan, the brand name form of fluconazole, is a prescription medication used to treat fungal infections. It is also used to prevent fungal infections in people with a weak immune system. Diflucan belongs to a group of drugs called azole antifungals, which work by inhibiting a fungal enzyme needed for the fungus to grow. This medication comes in tablet and oral suspension forms. The oral form is usually taken once a day by mouth with or without food. Some of the common side effects of diflucan include headache, diarrhea, nausea, and dizziness. Do not drive or operate machinery until you know how diflucan will affect you. This medication is only to be used if prescribed by your healthcare provider. For RxWiki, I'm Bethany Molstein.
Issues applied in Ecuador. Invasive candidiasis is an important healthcare-associated fungal infection that can be caused by several Candida spp. The most common species is Candida albicans, but the prevalence of this organism varies considerably depending on geographic location. The spread of disease of invasive candidiasis ranges from minimal symptomatic candidemia to fulminant sepsis with an associated mortality exceeding 70%. Candida spp are common commensal organisms in the skin and gut microbiota and disruption in the cutaneous and gastrointestinal barriers, for example, owing to gastrointestinal perforations promoting invasive disease. Candida spp are among the most common pathogens in nosocomial bloodstream infections. Current mortality rates remain high at around 40%, comparable to Pseudomonas and higher than Staphylococcus aureus and bacteria belonging to Enterobacteriaceae. Additionally, candidemia is more common in high-risk patients with underlying comorbid conditions, including those with immunocompromised status, central venous catheters, ICU admission, or recent surgery. Conclusion. I think that invasive candidiasis is the most frequent invasive mycosis in critically ill patients, targeting patients with a high-risk profile, development of new non-invasive diagnostic tools for early diagnosis and therapy, and optimization of management strategies, prophylaxis, preventive therapy, or empirical therapy, along with availability of new antifungal agents may allow to overcome the ever-increasing threat of candida infections. Invasive candidiasis is a fungal infection that occurs when candida, just like fungus, enters the bloodstream and then spreads through the body. Candida is the fourth most common cause of bloodstream infection among hospitalized patients in US. Persons at high risk for candidemia include low birth weight babies, surgical patients, and those whose immune systems are deficient. The symptoms of invasive candidiasis are not specific. Fever and chills that do not improve after antibiotic therapy are the most common symptoms if the infection spread to deep organs such as kidneys, liver, bones, muscle, jumps, spleen, or eyes. Additional specific symptoms may develop with variety depending on the site of infection. If the infection does not respond to treatment, the patient's organs may fail and cause death. Invasive candidiasis is usually diagnosed by either culture of blood or tissue or by examining a sample of infected tissue under the microscope. Invasive candidiasis is usually treated with an antifungal agent called amphotericin B and that is given intravenously IV in the vein, or it may be treated with the azole drugs taken by mouth or IV.
Invasive candidiasis is a relatively common infection in children and also in neonates, especially with the increased incidence of premature babies. We are getting more cases of invasive candidiasis in neonates, and in our country, overall there is an increase of PICU and NICU admissions. So the incidence is increasing and increasing day by day. So as you know, in neonates, the important risk factors which leads to this invasive candidiasis is prematurity, low birth weight, broad spectrum use of antibiotics, and for longer duration, especially invasive methods like catheters, endotracheal intubations, abdominal surgeries, and of course, use of H2 receptor blockers and antacids. So out of all this, use of broad spectrum antibiotic is the most important factor which leads to this invasive candidiasis. Now we know the use of, now we are coming to the prevention, because we know we don't have much antifungals in our hands to treat this invasive candidiasis. So prevention is the most important factor which will help us to treat this patient. So coming to the prevention, the most important thing is, as I said, judicious use of broad spectrum antibiotic. Second, of course, you have to have a very good hand hygiene method to keep the NICU free of infection. Another important factor and mostly practiced in most of the NICUs is if you have a very high incidence of invasive candidiasis and if you have babies of less than 1,000 gram, that is less than 1 kg, it's better to go for fluconazole prophylaxis in the dose of 6 milligram per kg twice a week and to continue till the baby is little stable. And you can use this even in high-risk groups, the high-risk factors, as I said before. The use of oral nystatin and the use of probiotics to prevent candida infection has not been found to have any effect. So presently we have only as a fluconazole prophylaxis as the main way of prevention. In addition to that, we can also use judicious use of antibiotics to prevent invasive candidiasis in intensive care centers.